really struggling with transparency around where we had capacity and where we had increasing demand. We were a very manual system. Within the bed management team, we used pencil and paper to manage our beds. We had ward staff updating us via telephone call or by pager to tell us about discharges. We never had a real-time picture of where we were at.
Before we implemented Patient Flow Manager, we had identified that we didn't have an awful lot of transparency on what was going on within our hospital. We were trying to do a lot of work around improving our emergency flows and our admissions out of the emergency department. We would regularly have multiple patients, admitted patients sitting in our emergency department awaiting beds. We wouldn't be able to identify where the beds were going to be for those patients. We were doing a lot of our bed management by guess, an estimate, without basing it on real facts. So it was very challenging for us.
The system that we had prior to Patient Flow was an older system. It was an outdated system and one that often would crash, and we'd need to rely on a paper-based system in order to get our referrals through. We were spending a lot of time going back and forward to wards, making phone calls.
We had some systems that were already in place. We had processes around understanding who was currently in our emergency department. We had paper-based systems around our electives coming in. There was an unknown demand that existed out there around patients that were being transferred from other hospitals that we were capturing through various ways, but there was no way of actually managing this. So we had pieces of information, but we weren't able to pull them together into one system that would actually give us an overall picture of what was going on within the hospital.
As part of the national standards at the Royal Melbourne Hospital, we were struggling with clinical handover. We also had the inability to be able to audit our clinical handovers, and this was really compromising our ability to make some improvements. We were looking for a solution to help facilitate some of our process improvement in that area. The ability to marry the emergency demand with the elective demand on a daily basis was a real struggle for us, but also we had no ability to plan ahead. We had no ability to understand where our discharges were forecasted for the next day and then where our forecasted demand was going to be for the next day. We were waiting until we were actually in the midst of crisis before we were able to react.
We needed to understand exactly what was happening in our hospital in as close to real time as possible. The solution we chose was Patient Flow Manager. It offered that one-stop solution across all the areas that we wanted. We were able to combine our emergency demand, our elective demand and our add-ons in one system. We were able to meet the needs of our front-end users, to be able to streamline their processes, to make their processes of referral to Adelaide Health more efficient, to streamline their handover processes. It really was a simple solution for us in the end to choose. We were able to work closely with Health IQ to develop a view that the front-end users were comfortable with, and we were able to really explore the opportunities within the product to meet some other needs.
In partnership with Health IQ, we were able to have frontline operational Melbourne Health staff work together to create a tailor-made patient flow management system, incorporating our needs within Access, so a fully automated bed management solution, and also electronic patient journey boards for all of our wards.
We were in control of what we wanted to put on to Patient Flow. So we needed information not only about the patient's name, their location, but also about the reasons for referral, how long they'd been in hospital for, what was their presenting condition.
What I really like about the patient flow management system is the ability for the bed management and after hours hospital management staff to be mobile within the organisation. So they can now be at the forefront managing access issues, whether it be in the emergency department or on the ward, and then still being able to allocate beds, forecast capacity issues, manage our elective demand, all from a remote location.
This technology has significantly impacted our own work in allied health, as from a dietetics point of view, around that portability of the information, around the ability to be able to triage patients a lot quicker, having a lot more information. So we've got information that the nursing staff are inputting about the patient. We've got information about the medical team that they're inputting as well. It's allowed us to have that information on a web-based platform, so we can use it on portable or mobile devices. And it's also allowed us to have a lot more of that information on the patient journey boards up on the wards as well.
The real-time transparency around patients being discharged from hospital has really impacted my role within the access and demand unit. Previously, there would be some periods of delay between a ward alerting you to a patient for discharge and us being able to then plan accordingly.
Our problem when we went into this was around understanding our flows and understanding what happens with our beds. I haven't seen a better solution out there that is actually able to clearly address that need.
If anyone else was thinking about using a patient flow system, I would strongly recommend it. It's a system that allows that integration between allied health, nursing and medical, and it also allows for allied health to have their own unique tweaks on the data that they require as well. For example, things like reporting, meeting KPIs, ensuring that the information that they require is in there and it's able to be accessed by all staff.
In talking to other hospitals, I would strongly advocate that they explore Patient Flow Manager as a solution for them. There are other solutions that work in this space, but none of them are built around flows and understanding demand, and I don't think hospitals do this stuff well. So I think this product is particularly good at meeting that need. The feedback from the staff has been glowing. We now know what we didn't know before, and we now make decisions based on fact.